Family Union, of the Family Association Union. It's a pleasure for me to welcome you to this international session on feminine genital mutilation, titled A Model of Intervention with a Community-Based and Intersectional Approach. Today, as we are talking of feminine genital mutilation, I want to take advantage to show our anger against the assassination of a minor child by the hands of his father, who had a sentence by the judge and was a failure of our system. And now I want to open our day on feminine genital mutilation. And I have to say that we have the support of the Ministry of Inclusion, Social Security and Migrations and the Forum of Integration. We want to thank the Ministry for their support, not only during these days, but also because of their support to the work that we've been doing for more than 15 years to promote the access to sexual health and to work against feminine genital mutilation. Our association is a non-profit association which pulls 20 entities and promotes the rights of women and families from an approach of inclusion and defense of human rights. We are engaged against any kind of abuse and with a fight against feminine genital mutilation. Throughout these years, we have become a reference entity in the prevention and intervention in the cases of feminine genital mutilation and in the assistance to women and young childs, both internationally and in our country. We've worked through sexual training with women which are working in this field with an intercultural approach and combine the work of different people and with this support of different entities in the network. And our aim was to contribute to different approaches to understand the context and give an answer to the situations in which feminine genital mutilation takes place. These international zero tolerance days have become a reference for professionals, for activists, and for the general public. And this day, it's a reference to fight against this aggression. We have contributed to the prevention and to the assistance of people suffering from this practice, and we have developed strategies and good practices, and we've provided knowledge to different associations, to civil society, to the entities, and we've provided to generate public knowledge. We have always vindicated a general approach involving different professional sectors. The need of an international coordinated strategy and the importance of the knowledge of the good practices of other European organizations and the origin countries. Apart from this, we have dived into the different tools available to contribute to leave behind this kind of violence. We have contributed to society, to sensibilization of this society, and we have contributed to the decision making. We have supported the leadership of the people who have suffered feminine genital mutilation. We have analyzed the role of communication agents who are important for the defenders of rights, of human rights, and we have waited our way of looking at this way of violence, which is associated to other kind of violence against women, such as forced marriage and sexual violence. In this way, we have highlighted the importance of reinforcing a comprehensive attention to women and children suffering this violence. Throughout the last year, this is a practice that has been conducted in the international and national environment, and different measures have to be taken to fight against it and to give assistance to women and to children who have suffered this violence. But we are still in front of a difficult situation due to the pandemics of COVID-19. And following the recommendations of the report that has been drafted for Spain, the different measures for attention, prevention, and reparation for women suffering feminine genital mutilation have been highlighted. It's important to provide attention from a comprehensive approach, taking into account the violences associated and the consequences. This is what we are working in the UNAF and in the network against the feminine genital mutilation. All of this is part of an intervention model that is being developed and has been developed together with other expert entities fighting against feminine genital mutilation in a community, with a community approach. During these couple of days, we want to share this model. We want to dive into the different practices that have been implemented by the different reference entities, and we want to approach the challenges both internationally and in our country. The idea is to generate a place for knowledge sharing and to share in pioneer initiative, which are a reference in Spain. Hopefully, our experiences will contribute to put an end to this gender violence, which affect millions of women all over the world. And I wish you very highly enriching day and wish you a very good working day. Before finishing my speech, I want to thank all the technicians that work within our entity, within UNAF, to put an end to feminine genital mutilation. Thanks a lot and have a nice day.
Muchísimas gracias por su intervención, Ascensión.
Thanks a lot for your intervention. Thanks a lot, Ascensión Iglesias, for your support and acknowledge. Thanks to Sarai, thanks to all our colleagues, and thanks to all the people that have joined today. Hopefully, we will be able to see all of you, to identify your names. We'll have big people involved and lots of friends listening to our panel. Thanks to all the experts, to all the leaders that are fighting day after day against feminine genital mutilation and who take part in these kind of events. I want to share a short presentation, but I will try to be concise.
Pues estamos. Pues sobre todo, bueno, estos agradecimientos a todas es porque forma parte un poco de la génesis.
After thanking you all, I want to say that we work within a network and it's important to recognize that the model of intervention that we are following comes from UNAF, but also from a network, a work that is being conducted together with other entities within this field. And after 35 years of work supporting the rights of all migrant families with this gender approach, this intersectional work has generated this model of intervention that it's not our own. It's been elaborated, sharing the experience of all of us. And there are lots of organizations who support this model. It is important for us to reflect on this model, to present it to all of you and try to understand it so that we become conscious of all the work that is being conducted from side of organizations and activists for a long time. I also want to thank lots of women who couldn't join us because of their personal situation. All our support from here. I want to say that we are a big team. There's a big team beside us. As Ascensión mentioned, the aim of these days is first to present this comprehensive model, to try to provide a generic approach of the work that we've been conducting internationally and nationally as well. And we want to show some of the main axes of our work. And this will be the principle to exchange the ideas of different entities working in the field. We'll present different models, different ways of working. This way we will be able to copy the things that are interesting and we can keep working all together. A clear approach is not only to show and identify those axes, we also want to identify the different challenges and needs which are evolving, and sometimes we widen the way we see the situation, and we want to take into account the political and social challenges, and we want to put them into our roadmap, and we will do this during this couple of days. One of the aims of these days, which we would have liked to hold face-to-face, but finally the idea of holding these days on Zoom or on a virtual setting allows us to join from no matter the place where we are, and this allows everybody participating. I remind you that we have a system of questions and answers, and we can participate while the different panelists are presenting. Another of the aims is to share different ideas and initiatives. In Spain, we are doing a big work which are part of these main axes that we want to present, and we want them to be acknowledged internationally. We want to generate a discussion at an international level. Sometimes we forget about the importance of sharing all this knowledge, but we have the possibility of doing this, and that's why we have interpreting into English today. I hope that we will have lots of international people joining us, so welcome to them as well to this, to our setting. In this slide, I want to present the idea that I mean when I talk about a model of intervention. This is not a one-way model. It's been built from different organizations, and we want to present what we know, and we want to systematize it and organize it. From the approach of feminine genital mutilation, as Ascension said, it's important to mention the gender approach, this intersectional feminism, in which we understand the feminine genital mutilation as a gender violence. It's a way of violence that is not isolated. It is included in this violence continuous that we suffer as women from the moment we are born, and it's another kind of expression of this set of violences. And when we want to sensitize, we have to take into account this approach of gender violence, and we have to understand how it is related to other ways of gender violence to present, because they are presented in a unified way normally. In the sense of feminine genital mutilation, we cannot focus on violence gender only. We have to take into account an intersectional approach, because not only people who have suffered feminine genital mutilation are suffering from gender violence. Sometimes they are part of a specific social situation. They are affected by migrations, by other colonial structures, which set them into an inferiority situation. They are the victims of inequalities in the world. This is something that has to be understood, and human rights have to be understood as well, not only as a new utopic approach, but from the reality that human rights are aimed at everybody, and we need to be able to guarantee them. We have to take into account that it's the duty of the states to guarantee the different human rights to everybody. This idea is shared by all the people who work in this area, and each different entity provides different action lines and different approaches. In UNAF, we have these working lines, these action lines that you can see on the screen. We work in training to professionals, we provide specialized materials, and which are the challenges that we identify and that we want to deal with. Regarding professionals, we don't want to stay in a preventive state because what we are detecting right now is that professionals are highly saturated. There are lots of challenges that have to be dealt with, and sometimes we don't manage to do all that we want. So we want to provide specialized materials for specific professionals, for gynecologists, for primary attention professionals, and for social workers, so that they can use a different approach from this social work vision also to psychologists and sexologists who have a very important role, and they have to integrate the approach of genital mutilation in their work. We think that from the professionalization and specialization of the people working in the field, we can deal with a comprehensive approach regarding the attention to victims. And that's why we are producing specialized materials to approach and to implement this strategy. And we are working in sensibilization and communication, and also in the social and political incidents. In this axis, we work with victims and with intercultural mediators. They are professionals who have a key role to understand the different realities in attention to the other, in the way we approach all the kinds of gender violence and how they interact. This is a work which allow us, as we will present later, to develop this pioneer model for attention to women, to victims, women and child who are victims of feminine genital mutilation. As you can see in the middle of the screen, the key is on coordinated work and network work. We have to base this on a specific approach and different ways of conducting an effective work. We have to understand that we have limited resources and that our system is not favorable to the approach to other ways of gender violence. The only way we can approach it is from the point of view of network and coordinated work. Throughout these couple of days, we want to identify these focus, these approaches, and the different challenges that we have identified from UNAF. From the point of view of the work that we develop as professionals, the challenge is how to reach the people affected, how to be present in the day-to-day situation, how to come out to the street, to our districts, and get involved in what's happening, to work in the field, to work close to our neighbors, to our colleagues, and to settle strategies, coordination strategies and network strategies, which are focused and considering the involvement of all different people. Considering this detailed work with the approach of social transformation, we have realized that there's a wide influence in the community-based work. That's why we wanted to take this into account in the work we are conducting this couple of days, and we have decided to give importance to the role of these leaders, of these cultural mediators, And that's why another challenge that we've identified is to support the different associations of migrant women, activist women, which are very small and have problems to have access to resources, to funding, and we have to focus in this work as well. As one of our strategies and regarding the prevention and support to professionals, another key axis is comprehensive work from a biopsychosocial point of view and also from a sexological point of view. We are not only dealing with gender violence, but apart from that, all the professionals involved have families, they want to get involved, and we go through different realities, and we have to give attention to the victims in this comprehensive context and with a comprehensive approach as people who have a community context. And as I said, from a sexological point of view, because sexology is a key point, a key character of people's sexuality is formed by psychological, cultural, socio-economical, biological, ethical, environmental factors. In this sense, sexuality is a way of being in the world, is a way of feeling, a way of relating to each other, of behaving. This has a global impact in ourselves. And that's why we want to have a clear approach regarding sexual rights and reproductive rights, because we think that sexuality is a comprehensive part of ourselves, and it's influenced by lots of uh, lots of cliches, lots of roles, lots of factors, and we need to approach all of them. There are lots of stereotypes in the way sexology is approached. Lots of services and resources are available regarding the different models of sexuality and about what we think it's allowed or not. And that's why we need to have a comprehensive approach. As we know, sexuality is dynamic, it changes from the point we are born until we die. That's why we think that the comprehensive approach from the point of view of feminine genital mutilation, we have to work in restitution as well as in other forms of gender violence, because they are affected by a violence continues because there are lots of factors which influence the situation of women victims who are victims, and that's why we have to vindicate the comprehensive attention which considers all the factors and all the consequences of this violence to improve as far as we can our reality. What we want to show you today is that there are also other challenges that we may not mention, but we want to show the idea that there are other challenges that have not yet been developed within this model. We have to consider, for example, an intergenerational approach, specifically for migrant families. It's important to work in this framework. We have to establish a dialogue that sometimes it's broken, I am sure that during the day, we will have the opportunity of talking about this and to give another approach on interculturality. And I am sure that we will manage to establish links between the origin countries and host countries, and we have an important role as mediators. Now I want to focus on a project that is very exciting. We've been working on it for years, and it is something that we've been thinking of together with our colleagues. Different entities have been working on the attention to victims of genital mutilation and their communities and the affected communities. In UNAFO, we've been reflecting about this, and it's important to think of it before we go forward, because we work in sensibilization, we work in personal transformation spaces, and in a very in-depth work with professionals and with decision-making, with decision makers. And we've been thinking of this social transformation. We don't want to generate duplicities. We don't want to take the role of public entities, and there are things that we cannot do. We don't have the resources, we don't have the knowledge, we don't have the capacity to develop it. And therefore, we have reflected about who we are, which is our experience, what are our resources, and here we have developed our project.
We've also been conducting research work, including research about gender violence during the pandemic and analysis about the strategies developed in prevention and care in the face of gender violence, focusing on other forms of gender violence and on gender violence against migrant women. And we've been considering how resources and action protocols could be more or less effective. We will also be presenting throughout the day tomorrow a project that diagnoses needs to address other forms of gender violence for women who are in situations of vulnerability, women who are migrants or in the diaspora. And thanks to this research work, we have really become aware of what lines of work were missing in our care. And one of these lines that we saw clearly is the need to improve coordination between professionals. This is a really key line of work because resources and services are overloaded. There is a lack of knowledge, a lack of information, and sometimes it's just a very dizzying process. You don't know how to address something or what your role is within such a big chain of professionals. So often channels get broken, or people are not referred to the professional that they should be, or coordination is lacking. And this often involves re-victimization for women who find that they are sharing their experiences over and over again with different professionals. And often a lot of women are simply left out of the system because the system gets very complex. Sometimes they don't connect perhaps very well with the professionals. And we end up sometimes getting lost. And certain women end up, like I say, falling out of the system. And of course, there are also boundaries on a cultural level. There's an intercultural issue, there are language barriers, there's a lack of knowledge on how resources and services work, and just overall difficulties in integration in Spain, both on behalf of the women towards the resources and on behalf of the resources towards the women, because they sometimes fail to access those women who need them most. And so this shows gaps in the system. And then also in terms of training and of this lack of knowledge surrounding female genital mutilation, this is also very relevant compared to other forms of gender violence. So we thought, what can we do? What is our role in all of this? And what is the specific role that the Family Associations Union can play? Well, we developed a project, which is what we're presenting to you here. It's a pilot project that is currently beginning in Spain, where what we do is focus specifically on the needs of the women with this biopsychosocial approach, and we are in direct contact with affected communities. And based on that, we develop support and comprehensive guidance for all of their needs. And to that end, intercultural mediation is the very first tool, the very first strategy, and the very first professional line to access women who are often, like I say, out of the system completely. And by working with the community, inside the community, sometimes there are lines of communication that we as professionals cannot access. So these intercultural players act as a bridge to facilitate information, to translate, to adapt the information that we are sending out into formats or languages that the population, the target population, can work with. And it's also that direct relationship with these women where intercultural mediation is crucial in overcoming taboos and fears, cultural shocks, and a lack of trust in institutions, because intercultural mediation can help to overcome some of these barriers and make contact more direct and more profound with these surviving women. So in this regard, as I was saying, we thought, what do we do? In our project with women, we have held interviews, personal face-to-face interviews. We have held awareness raising workshops, continuity workshops, to really try and overcome a lot of the myths, break down some of the stereotypes, define and establish gender roles and gender violence, supporting women and sisterlyhood, sorority, and then also detecting needs. Sometimes they are voiced directly and other times they are discovered over time. And so we have established coordination mechanism with public resources, because that's a priority, to ensure that public resources truly reach the target audience, and also with associations in addressing things that the public sphere cannot. And we cover health, social, economic, family, psychological, sexological, and all these kinds of aspects on a comprehensive basis, also as a complement with other resources and services. So we at UNAF have tried to ensure that any of the matters that cannot be covered with public resources can at least try to be covered by UNAF through this project, making sure that people truly get this comprehensive personal transformation process that they need, and that they can really access the restitution and the repair that they need in the face of gender violence. And as I was saying, one of the keys for us to develop this whole project is networking and associational support, because networking, as we have already mentioned, requires coordination with public and associations, public resources and associations. But we've also tried to take a leap, which we've been working on for years, but now we have really managed to do it. And that is associational support. Because there are a lot of things that UNAF as an institution, as a statewide institution, it has a lot of impact and a lot of awareness raising, but there's some things that in the field we cannot do because we don't have the outreach in the field that perhaps is necessary. We need to understand our limits, because that's really important. Public institutions and associations need to be aware of what they can and cannot do and acknowledge who they are. So we work on building associational support for associations of migrant women, leaders, activists who have been battling against female genital mutilation for such a long time, but that often lack the financial resources, the personal human resources, and they often encounter limitations in their interaction with public resources or institutions where their voices are, let's say, not heard, or where they are placed as, they are seen as simply experienced people, but not as professionals, which they are. So the challenge in this project is to change this, among other things, and to provide our humble support as best we can, acknowledging our limits, and to do all of this alongside other specialized associations who have perhaps more direct contact with the communities and who can truly reach the women in a way that we are unable to. To do so, we are launching this pilot project that I've just been talking about in the community of Madrid with the Women's Association of Guinea-Conakry, which we'll be hearing from Fatoumata about later. Also in Fuerteventura with the Intercultural Association of Mauritania and Bay, which you'll be hearing more about tomorrow because they're developing a very interesting project. We're also working in Valencia with Aminata Soko and her network. She'll be telling us a bit more about her experience in Valencia, and also in Castilla-La Mancha with the Association of Women of Castilla-La Mancha. This is certainly a challenge, but what we do is provide our know-how, our financial resources. We foster interrelations between institutions and a search for resources. So that is our role and our position. And now just to really sum up, because I don't want to go on for much longer, I'll share with you what we offer in this project. I'm just going to outline a bit of what we aim to offer. Initially, what we provide is guidance for women with the support of intercultural mediators who detect needs and say, hey, look, perhaps UNAF can help you with this. We do things calmly, gently, with active listening, and gradually we start building on their needs and trying to answer them. We, in reality, are finding a lot of women, a lot of people who are outside the system with a huge lack of knowledge. So this calls for a really calm process, understanding the public resources that they can need, and then finally provide a really broad framework of support based on the specificities of female genital mutilation. And we also provide guidance for professionals, because we have managed to build this network with other professionals and with other associations, but often professionals simply don't have the support. And it's crucial because these situations can be quite dizzying, can be quite staggering, because you don't want to get wrapped up in myths or stereotypes. You want to help, but you don't know how. So having a key figure to provide counsel, to provide support, and to understand the cases is really fundamental. So it is in this process of coordination and referral to other resources that we come in. We try to collaborate with the entire network of experts, of professional women who we work with. And we offer information and guidance. Another thing we do is, within that guidance, something crucial for social transformation is to not only provide individual support on an isolated basis, but to foster the creation of groups of women that will create, let's say, a community where they can get to know other women who are suffering the same situation, because on a psychotherapeutical point of view, this can be very important. And also on an intercultural basis, we foster dialogue and discussion on a broad approach, understanding other forms of gender violence, other realities, other cultures. And this ultimately helps to provide real integration. So we think it really is very important, crucial in fact, to work with all of the associations and to foster this community and social participation with specific spaces for women to talk to each other, to share, and to ensure that these are safe environments, because not just as survivors of gender violence, they are also migrant women and marginalized women. So these spaces have to be horizontal and very safe, and have to, I think, not always involve a lot of professionals that would make it feel less safe. We also guarantee this psychological and sexological support that I was mentioning earlier from these dual perspectives, based on psychology, because gender violence, female genital mutilation has this very strong psychological approach because it's a traumatic experience, which ultimately needs to be addressed from a psychological point of view. And it also affects sexual and reproductive rights and our sexological development. So we also need to provide this sexological approach as well. To do that, we work with other benchmark professionals who can apply these approaches or who can help and guide us. Or sometimes we will develop this care and try and provide it ourselves. And this approach that I was talking about always has to be comprehensive. It has to understand all of the consequences of gender violence and all of the needs that it entails, because sometimes in order to work on the specific consequences of gender violence, and more specifically female genital mutilation, you first need to overcome other issues, social issues, family, work-life balance, paperwork, bureaucracy, and a whole series of factors that influence their realities. So it is a long-term process. And okay, we do achieve short-term and immediate results, but ultimately what we believe is that we need a model that looks at the long term, a model that is calm, that truly gently guides the women, that helps to integrate them, and that has reference people for them to turn to, like lighthouses, in case they get lost in the system or in case we get lost as professionals, thinking, you know, what am I missing and where should I turn? So that's the work that we're building on right now with our project, because we have to understand that public resources can't always encompass this whole project, this whole work. And sometimes it is association that is more specialized in the aspect that can provide the service we need. So what we need is to have a really good corpus of specialized intercultural mediators who understand what resources are available to connect us all together and provide support for these specialized expert associations who work closer to the communities and who are led by activists, because ultimately they know how to do this more than anyone, better than anyone, because they really understand the needs of the women who are involved. And what we need to be is facilitators, enablers in channeling their expectations, providing the counsel that they need, ensuring the coordination, making sure that the right doors are being opened at the right time. And to, as we will hear during this last table tomorrow, we have to take all of this into the field of social and political incidents, where all of these schemes, these lines of work, and this detection of needs can be applied to generate new public policies, new strategies, new assignments of resources to truly tackle this issue. And one of the challenges we see here quite clearly is the need to foster more projects that support the associations of women, of migrant women, and create these safe spaces that I was talking about, that other migrant women truly need thanks to these associations. We really think that this is fundamental, and it is a line of action that I think has not been very catered for in this area, especially in other forms of gender violence. So that's all from me. And I hope to have successfully shared our approach and the project that we're working on. Because as I said, we haven't invented the wheel here. This is the work of a great many professionals who no doubt are here with us today. And I'm sure you're familiar with all of these models. If anyone has any questions or any remarks that they would like to share.
Si queréis hacer alguna duda o alguna consulta.
If you'd like to share any comments or any questions, you can also write in the question and answer function. Thank you, everyone. And we should be in Andalusia soon. Well, you're absolutely right, Liliana, as you wrote in the chat box. If anyone has any initiatives, any ideas, this is definitely a pilot project, and we hope it is going to be very widespread. We hope to learn a lot as we go on from our colleagues, because it's going to be a very horizontal project, I think, and our colleagues will tell you more about that later. And all together, we can consider how to tackle this issue. Hello also to the people from Melilla. Okay. Gloria, in response to your observation, we have the website, the UNAF website, with specialized resources on sexuality, on cultural aspects, depending on whether it's intercultural mediation, female genital mutilation, or a whole series. There's a different series of sections with specialized materials, both for direct work with the communities and for work with the professionals. We also have lines of work for the education system. We have awareness raising, and it is also adapted to the educational sphere. We also have Ibrahim, who works in the battle against female genital mutilation. You'll find plenty of information on our website.
Genial, pues Pilar Castaño nos...
Okay, great. Pilar Castaño has also told us that there is the trafficking unit, the human trafficking unit, because we know that there are other forms of gender violence, and that's definitely one of the lines of work that we're building on within the Istanbul Convention. We need to work on this. We have a convention here in Spain as well, where institutional work is being carried out, supported by activists and by associations. And so, of course, yes, we have to coordinate this and be a network in this respect.
Efectivamente,
okay, another comment that has been written in. Yes, there is also the Acogida Humanitaria Network, the Humanitarian Shelter Network. And as Sandra Elizabeth has written in the chat box, it is really important to be able to make this really a much more mainstream issue, both in terms of gender mainstreaming and promoting cooperation strategies and ensuring that the work is rooted in the communities at a community level. Because often we work on a state level, on nationwide level as organizations, and sometimes we are lacking a bit in the community level. In this regard, I think having the local city councils included is crucial. It's one of the things we're going to be talking about tomorrow. We're going to be talking about examples of where public institutions develop and promote cultural intervention initiatives, or sometimes they stem from associations and then they go into the public sphere. But of course, we think that this whole intervention is important to ensure interculturality. I don't think there is a similar model in the Balearic Islands, but we'll look into it. Or if anyone who's listening knows more about this or would like to take the initiative, then that would be great.
Bueno, si no hay más preguntas, agradeceros a todos.
So if there are no more questions, I just want to thank all of you for listening. Thank you, everyone. Thanks also to the Aspacia Foundation, who we are working together with in sexual violence projects. There's a lot of networking going on there.
Marta Costa consulta también cómo...
Marta Costa has asked what strategies we can use to ensure that small organizations can also access the resources that are available. Well, I think one of the key things we can do is to ensure social and political advocacy to really work along those lines with specific strategies. We've discussed this in terms of gender violence. It's one of the recommendations in the report, the research report that we conducted, this prevention and detection of gender violence strategy. And also within organizations, access to resources should be, I think, revisited. We should adapt our work strategies and share resources. Sometimes this can be a challenge because we all know that we are in the tertiary sector, and it's quite a precarious sector, but we really need to foster these dynamics of support, collaboration, of seeing other organizations, institutions, not as the competition, but as collaborators, as sisters, as supporters, and to share resources amongst us to make sure that others can access the resources that we offer. And I think that really is crucial. There's another question about the region of Castilla and León, and we work with the Association for Attention to Women, Female Survivors of Gender Violence, called Plaza Mayor in Salamanca, and also the Association of Progressive Women, who also work in associations and in networks. But if you know of any other organizations, or if you belong to one and you would like us to become more coordinated, then great. And if there's anything you might need, you know that you can reach out to UNAF. UNAF@UNAF is our generic email address. And you can reach out to us about any strategies, lines of collaboration that you can think of. Go ahead and do that, please.